Well, the FDA is warning parents not to feed their infants homemade formula. Now, the alert comes after reports of infants being hospitalized for a rare condition who were fed DIY formulas. As KXAN investigator Arzo Dose explains, recipes found online worry some pediatricians.
The Austin Diaper Bank is seeing a spike in need. More families needing diapers, and now more families needing baby formula.
We've seen a 25% increase, just especially in the last few weeks because of the winter storms. Families were without water. There were a lot of issues of getting to the store. And then also we're just seeing poverty rates increase because of the pandemic.
As the need continues, the FDA is warning parents not to make their own baby formula. A spokesperson with the agency says they've gotten reports of infant hospitalizations in Delaware for hypocalcemia, which is low calcium in the blood. Symptoms include seizures, vomiting, and lethargy. The FDA spokesperson says it can even lead to heart problems and other foodborne illnesses that can be life-threatening.
It is not safe.
Pediatrician Dr. Lisa Gall with Texas Children's Urgent Care in Austin says babies should either be fed breast milk or FDA-approved formula, not a mixture made at home.
There's, contamination leading to infection and illness risk, and then there's a risk that your child may not be getting everything that he or she needs.
The FDA strictly regulates infant formula to make sure that key nutrients and vitamins are included in appropriate amounts. The agency says homemade formulas are not regulated. We found a number of recipes online that include raw cow's milk, sugar, and egg yolks. Dr. Goss says these are ingredients you should not be feeding your infants.
When they're this young, their bodies are still developing, and the way they process things are a little bit different than, say, even a one-year-old toddler.
That's why the Austin Diaper Bank has strict rules when it comes to accepting formula donations. The nonprofit only takes unopened FDA-approved infant formula that's at least 2 months from its expiration date.
And it's really important that we make sure whatever babies are eating and what they're drinking is safe and healthy.
Arzo Dose, KXAN investigates.
And we checked and there have been no reported cases in Texas, but the health department says that hypocalcemia is not a condition that's required to be reported. The FDA says parents with infants who have been fed homemade formula should talk to their pediatricians to report any symptoms. Now, the agency says there is no shortage of formula. Dr. Goss says if this is an option you're considering for your infant, talk to your pediatrician about that first.